Welcome to the Biotech Startups podcast by Exceeder. Join us as we speak with first-time founders, serial entrepreneurs, and experienced investors about the challenges and triumphs of running a biotech startup, from pre-seed to IPO, with your host, Jon Chee. In our last episode, we spoke with Barry about his upbringing in a family of physicians and how he developed resilience and a passion for education. We also discussed his academic journey from Haverford College to the MD-PhD program at the University of Chicago. If you missed it, be sure to go back and listen to part 1. In part 2, we continue our conversation with Barry as he reflects on his time at the University of Chicago, where he advised on My Choice, a program helping trainees explore careers leveraging their research training. We'll also dive into his fellowship at Boston Children's and Massachusetts General Hospital, where his research on zebrafish cardiac development uncovered the complexities of heart formation. Lastly, Barry discusses the realities of practicing medicine today, lessons learned transitioning to biopharma, and how he combined clinical care with research to create broader patient impact.
So as you're wrapping up your grad school experience, I know you ended up going to Harvard and, Boston Children's Hospital to do your basically your postgraduate studies and training. Can you talk a little bit about how that opportunity came about? I know you were also in Mass Gen. Can you just talk a little bit about that part of your journey and how you decided to commit to being in the Northeast?
Yeah, so after I finished med school, then I was still sort of on this academic path. And for me, that was part of what was ingrained to me really at U Chicago, was to be on that academic path. And in some ways, it's actually something that I think that I thought at the time needed to change a little bit at U Chicago. There was a very much of a disdain for people who took a non-academic path there.
Interesting.
And it came home to me because one of my thesis advisors ended up going into industry, and he was one of the absolute brightest people that I knew, and he decided to go to industry and into big pharma, and he was not very, his reputation in Chicago was not kept up because of that, and I didn't really think that was the appropriate way. But I still had this track, but it did help me in the end. There was a program that I actually helped set up at Chicago later on called My Choice, which was a program that got NIH and NSF funding, is now a well-established program at U Chicago to foster an interest in non-academic careers.
Cool.
So that program actually brings students out to Boston, for instance, and I've hosted them here. They go and visit various biotechs, and I've sat on panels for them where people who've pursued a non-academic career have talked to the students and explained to them first what's possible if you don't do a postdoc and get an academic position. Where else could you go, and then how to do that. And so for me, that was an important thing coming out of Chicago, is that at that point I was on this academic track. And so the next step is to do a residency. I chose a pediatric residency, partially because of my interest at that time in human biology and development. How does the body develop? And then after completing my residency at Northwestern University, I went on to join the cardiology program at Children's Hospital here in Boston. And that was, again, based on my interest, especially in understanding, refining even more my interest in development. How does the heart develop itself? Because for me, it's just a fascinating part of biology is, the heart really starts initially in the embryo as 4 cells. And then those 4 cells develop into a tube, and that tube folds on itself and forms 4 chambers, and then sends out the vessels that go, some to the lungs, some to the rest of the body, and then the vessels that come back from the body. Just thinking about how does that all happen? And then there's a right side and there's a left side. And then there are valves that have to grow, which are separate. And then there's a whole conduction system that grows within all of that. It's just to think about how that all comes together, and how the body, the cells are actually coding for that and telling all that to happen. It's just mind-blowing just to think about how the heart actually forms, not to mention how the rest of the body forms. But that interest in cardiac development got me to the cardiology program at Children's here in Boston, where the head of the Department of Cardiology then was a molecular biologist himself and had his own research lab on studying cardiac development. So I really came to Boston Children's as much for the clinical training in cardiology, but even more so for the opportunity to work in this molecular biology lab.
That's so cool. It's like, it reminds me when you're talking about just like as a kid, like being in the microscope, looking at the onion and just like that original, just like, and it kind of like, it comes back like kind of like full circle at a, obviously after, much more experience, obviously not just looking at onions anymore. And
exactly.
But
I should say an important part of how I did get here to Boston, since you asked, was, I actually did some rotations while I was in Chicago. I came out to Boston and spent several months here working with people. And that's something I encourage people to do, is to go and spend time at another place. It's sort of like doing your junior year abroad.
Yeah.
But, or even when somebody is at a company, sometimes they'll go and take time working in a different department. That's something that I encourage people to do frequently, is to go and just spend time in a different place, in a different institution, in a different line of work, and get a sense. It starts actually in graduate school, where you have to go and do rotations in different labs in order to choose which lab to do your thesis in. But that can continue throughout life. You can continue doing rotations to find out what you're interested in, or at the minimum, just to network and make connections and learn new things. And that's how I ended up at Children's, is partially because I had made connections with the people here, but also because I saw firsthand what was going on there, and really, to me, that solidified my interest in that place.
That's such great advice, that the rotations don't have to stop at grad school. Because sometimes you just think it does. You're like, all right, I'm on the track. I guess we're just going to go like cruise control like all the way through. But, you don't know what you don't know. And the only way you can kind of get that learning is just like by just putting yourself out there and getting exposure. And not to say that everything's going to be a perfect fit, because I'm sure there are probably, like, as you do rotate, like, and that you're just going out there, it's like, yeah, that wasn't a good fit for me. So like, and you just like, you at least can do a process of elimination. It's like, at least I know what I don't like.
Exactly. Which is equally as important as knowing what you do like.
Yeah, exactly. And to go back to UChicago just for a moment too, resonated with me, at least when, I think, and I always have to preface, Berkeley has changed a lot, but it was very much a similar kind of like separation of church and state, like where it's like industry and business should never commingle. Like, even if it smells like business, is like offensive. Because I know, like, even just like shooting around the concept of like theater, just to do like my, just like some market research. I was like, could this be valuable to you guys? I remember some of the conversations I had. Some were like, yeah, that seemed great. But then some of the other ones were just like, oh, you're going to the dark side. And I was like, oh, I'm just trying to help. I'm just trying to help, not trying to, extract anything from you. Mostly, do you think this could be helpful? But obviously things have changed now, where there's much more. Obviously there's stuff where it's like pure academic basic research should stay such, but there's like, I think it's much more of a gradient rather than 0 and 1, where it's like binary. And I think there's a lot of probably like existential dread for grad students, where you're like, if the only path is to become a tenured professor, that's like harder than getting into the NBA. And there's only so many, spots. And then you're just like, what am I, chopped liver after this? Like, if I don't get this position, like, what do I do? So I love that, the My Choice program is kind of like, hey, like, everybody, there are more options to, you're not going to be destitute if you don't get that position.
Exactly. And I think, as you said, things have definitely changed. There's been a shift. I mean, industry is no longer the dark side. I always joke because, for an established professor, their main accomplishment used to be to write a textbook. But now an accomplished professor hasn't made it until he started his own company, or he or she.
Yeah.
So
exactly.
That's how the mind shift has gone. But it's also, as you said, for right now, for graduate students, 2/3 of them are going to end up in a non-academic career. So it's almost been forced on the universities to acknowledge that there is life outside of the Ivy walls.
Yep, absolutely. And it's just like, yeah, like, we all need to earn a living too. Like,
Exactly.
We have bills to pay, and that's
Exactly.
okay. Like, that's like a reality of life. That's okay. We need to pay the bills. So you're now at, Children's, and I know you had a very long career there. Could you talk a little bit about kind of like, maybe if we subdivide them into like, and I think it was, around like 15 years at Children's. Can you talk a little bit about kind of like the early days, what that experience was like, and maybe we can move into like the kind of the middle portion and then the latter end. Can you talk a little bit about that?
Yeah. So my experience at Children's was as a cardiology fellow there, but the way the system was set up there, I could spend quite a bit of time in the lab. So that's where I got, obviously, it was basically doing a postdoc there in the lab. And we were working on zebrafish and zebrafish cardiac development there. I don't know how much you know about zebrafish, but zebrafish, when they develop, they're actually transparent for the first week or so of life. And so you can actually put the zebrafish under a microscope and see the heart physically beating transparently through the skin. And so that you could actually watch the entire development of the heart. But that the zebrafish became a great model. So that's how I got started there. I was doing clinical work as well, and getting trained as a pediatric cardiologist. But my primary interest was still in the lab, and how do I start to use what I'm doing in the lab to help me in the clinic. And then from there, I got a academic position at Harvard Medical School, and then also at Mass General, and joined Mark Fishman, who had a large zebrafish facility there, and was one of the most established zebrafish labs in the world. So I got to work there, but then I also had a clinical appointment at Mass General in the Department of Cardiology, or Pediatric Cardiology. So there, again, I was spending half my time in the clinic, seeing patients and teaching residents, and then half my time in the lab, running experiments and supervising technicians and others. And then the third half, of course, of my time was spent writing grants and trying to write papers and keep up on the literature. So obviously that's a typical scenario of being stretched pretty thin.
Yeah. And I was going to say, the first question, I was like, did you sleep? Did you get any sleep? Because I know each of those sound like, massive initiatives on each front independently. And I guess for kind of if we think about like the lab work and the clinical work, can you talk like, as you started like practicing medicine, I've never practiced medicine. What was like the things that you liked least about it? And maybe what did you find the most fulfilling aspects of practicing medicine?
Well, certainly the interaction with patients and the opportunity to have a direct impact on their lives is immeasurable and is extremely motivating. And I had the opportunity to work with babies that were born with very malformed hearts, and work with the surgeons who could then correct that, or work with children who had other congenital malformations in the heart that we had to help them get to the next step and medicate them. So there were very gratifying times. This is now in the time when prenatal diagnosis is starting to happen. And so families could already know when the child was still in the uterus that there might be a cardiac problem. So to be able to take a newborn there and get them through, especially that most critical period, and have the family then so grateful that we were able to really save their child's life. And that's just, there's no comparison to that feeling. So that was very motivating. I think the other thing about being at Children's Hospital, which is probably one of the best, certainly one of the best, if not the best pediatric hospital in the world, but also at Mass General, which is another, the other name for it is man's greatest hospital. But just to be around so many smart people is a great opportunity. And it's sort of a lesson for life. You always want to be around people who are smarter than you and who can teach you. And it takes a little bit of strength to be in that circumstance, because if you're around people who are smarter than you then all the time, then sometimes you feel a little bit dumb.
Yeah.
And you have to flip that around and say, well, it's not that I'm dumb, it's that I'm around all these great people who are inspiring and motivating and showing me the direction. But being around all those smart people was a great opportunity as well.
Amazing. Yeah, I always, the saying that always comes to mind for me is like steel sharpens steel. But but for me, it was probably not steel, like to begin with, far more malleable kind of material. And then I was just like, oh my God, I'm getting just trounced here. They're running laps around me. But I always think about like exactly what you said. It's almost like, like soak it up. This osmosis, like this knowledge osmosis, where you're just like, God, these people are so bright and it's so inspiring. It makes me want to work harder to kind of get to their level, because I want to be there. It's aspirational, honestly.
That brings to mind a saying. It's a saying that I think it was attributed to Teddy Roosevelt. I don't know if it's true, but he said that comparison is the thief of joy. So especially in those circumstances if you're comparing yourself to everybody around you all the time, and you have all these feelings of inadequacy, that's not a good way to function. So you have to be careful about comparing yourself all the time, and you have to learn, even though you're around people that are smarter than you, you don't have to match them. You don't have to be doing exactly what they're doing. You can do your own thing and use them as inspiration and use them as examples, but not use them as comparators.
Yep. And I love that. Like, that's a very important distinction, is to not measure your self-worth by that comparison, and kind of use it as more of like a kind of a motivational tailwind, more than anything. And I think also too, it's just like, to bring it back to sports, it's like, and I was talking about like, being a professor is kind of like getting into the NBA. It's like, not everyone can be LeBron.
Yeah, exactly.
And that's okay. Like, that also
doesn't mean you should stop playing basketball, right?
Exactly. It is totally okay. And you're not inadequate because of that. And for those who are, coming out of medical school and embarking on this, actually practicing, are there any just like tactical tips or maybe that you can give to succeed in that kind of high-paced environment, or maybe some common pitfalls that they should avoid?
Well, it's especially a challenge for physician scientists, and it's becoming even more and more difficult to be a physician scientist these days. Especially people who wanted to do either an MD, PhD combined, or have an MD but going into primarily a research field. it's becoming more and more challenging just because of, first of all, the demands of the clinical work, but also the challenges in getting, as you said, either an academic position or research funding, or knowing exactly where to fit in and getting the adequate support. So I think one piece of advice is to find mentors who can help keep you on track and also give you support on those difficult days, but also serve as a way to have an example of how things can be, and keep that in mind. So I think there are plenty of reasons to get discouraged, and not always good sources of encouragement. So when you find someone who gives you encouragement and is a positive example, hold on to that.
Yeah.
Just don't let that slip away from you.
Yeah, and I always think about, the kind of the impact mentors have had on me, and it is, I can't even understate it. Like, it's just like so critically important to find those right mentors who can kind of like a Sherpa, like kind of guide you through, because there's like, without that, it can be difficult, like immeasurably difficult to navigate. So I love that advice.
The other thing that I took out of being in the clinic was perspective on what is an emergency.
Yeah.
Because, especially in being a pediatric cardiologist, there are patients who literally were dying in my hand that I had to resuscitate. And as being a senior doctor in the hospital, when a code is called, so a code is when a patient has a cardiac arrest. The cardiologist is the lead of the team and has to run the code and tell the rest of the team members what to do. So that first of all, that leadership experience under that intense amount of pressure is a learning experience, but it also has helped me in the business world, because it's given me the perspective of what is a stressful situation, and it's helped me stay calm in situations where some people tend to get very anxious. And I say, this isn't really that much of this isn't that critical of an emergency. Let's settle down here and figure out the way. But in my mind, I'm thinking, I've been doing chest compressions on a patient. Now that's an emergency.
Yeah.
This maybe doesn't quite qualify.
Yeah. Yeah. And I think too, is if you let it happen in the business world, or just like an organization, like a business, everything can seem like a fire. Or at least like everyone's like, it is urgent. And when everything's urgent, nothing is urgent, because it's just like all the same. So I love that, just like the ability. And I think for business leaders, it's just like, it is important to stratify the priorities, because there's only so many waking hours in the day, and you got to go to sleep eventually. So you got to figure out what is it on that hit list that actually gets done and needs to get done, and kind of like sifting through. Where it's like exactly what you said. Maybe we can let this simmer for a little bit, and then not like be too quick to just like pull the trigger on this. So that's great advice, because I think especially for like folks who are like early in the entrepreneurial journey, everything can feel like a fire drill. And that's not scalable. Let's just say it's not a scalable practice. And so I know after your experience practicing medicine, you end up going into industry. Can you talk a little bit about how that, it sounds like you're learning a lot, surrounding yourself with great mentors, colleagues. What was it that kind of was like, I need to get to industry, and kind of what was the kind of catalyst for that?
Yeah, the main driver was an opportunity for me to be able to combine my basic science training and knowledge with my clinical interests. And I wasn't able to do that in an academic setting, as I mentioned. And I would spend part of the time looking at zebrafish hearts and studying why does the heart form on the left or on the right. And then I would go to clinic, and I was actually at the time running a preventive cardiology clinic where I was helping children who had elevated lipid levels and hypertension, but also seeing regular patients. And the two were so disconnected. And I almost had to, when I would walk across the street from the lab to the hospital, I had to change my mindset. and so I really was looking for a place where I could combine those two. And there is this part of biopharma industry, this translational medicine part, that allows some people to work with the scientists in the lab and take what they're learning in the lab and apply it to the clinic into making a medicine. And for me, it was just such a great opportunity. I had colleagues who had made the change to industry, and they were telling me the benefits of it. And I realized that was a perfect combination of my skills and to have also a broader impact, rather than on an individual patient basis, to really have the ability when making a new medicine to have an impact perhaps on thousands of people. So that was the main driver. I must admit that there were aspects of academic medicine and clinical medicine that were less appealing to me. And in the heyday, being a department chair was a great thing, and to have access to discretionary money for the labs, and to have time to be in a lab and to be able to train, that's all disappeared. And clinical medicine has changed quite a bit as well. So now so many of my med school colleagues do complain about having to navigate with insurance companies and productivity targets and prior authorization and all these things, the electronic records, and all these things that have sort of taken the joy out of clinical medicine. So looking back on what medicine has started to become, I must say I never regretted my decision to go into biopharma.
Absolutely. Yeah. It's like, I can imagine as everything that you just described is kind of like, I didn't sign up for this.
Like, exactly.
This was not part of the bargain. Exactly. I feel like duped here. I want to get back to actually helping patients and not doing this other stuff.
Exactly. But for the most part, it was, I was much more drawn into biopharma than trying to run away from academic medicine. I think that's a much better way to frame one's career, is to pivot to something that's an attraction, that's drawn, rather than trying to run away from a bad situation. So for me, that was very much the case, that biopharma had so much to offer and had such a draw to me that's how I ended up there.
That's all for this episode of the Biotech Startups podcast. We hope you enjoyed our discussion with Barry Ticho. Tune in for part 3 of our conversation to learn more about his journey. If you enjoyed this episode, please subscribe, leave us a review, and share it with your friends. Thanks for listening, and we look forward to having you join us again on the Biotech Startups podcast for part 3 of Barry's story. The Biotech Startups podcast is produced by Exceeder. Don't want to miss an episode? Search for the Biotech Startups podcast wherever you get your podcasts and click subscribe. Exceeder provides research labs with equipment leases on founder-friendly terms to support paths to exceptional outcomes. To learn more, visit our website www.exceeder.com. On behalf of the team here at Exceeder, thanks for listening. The Biotech Startups podcast provides general insights into the life science sector through the experiences of its guests. The use of information on this podcast or materials linked from the podcast is at the user's own risk. The views expressed by the participants are their own and are not the views of Exceeder or sponsors. No reference to any product, service, or company in the podcast is an endorsement by Exceeder or its guests.